Hit and run, victims not identified.
Drive out the vehicle. Head injury, GCF 6, massive blood loss, multiple laps, arrest on the field 8 minutes ago.
Passenger, airbag malfunction, didn't deploy. Cyanose, O2 sats at 80%. Pulse 120, respirate 35, BP 95 on 68.
Bed 1, Dr. Hamed. Dr. LeBlanc, bed 2.
1, 2, 3.
It's all yours, doctors.
Arnold, take compression. Activate MTP and insert 2 large bore IVs.
ABCs, doctor.
I'll intubate and decompress the chest bilaterally.
1, 2, 3.
We need 2 units O-neg, mags and E-fast. And I need an art line.
EMS radioed from dispatch. We have IDs. Mary Tabby 46, Anna Tabby 20.
This is a mother-daughter? Pneumothorax. We need a chest tube. And use a 28 French in case there's a hemothorax.
Let's sedate with ketamine. She needs 40 milligrams. Let's start her.
Still no pulse.
There's cardiac activity on the ultrasound, but her heart looks empty. 1 meg epinephrine.
Epi won't help if there's no blood for the heart to pump.
PEA narrow complex. Not a shockable rhythm. Restart compressions. Let's focus on resuscitation using blood products.
Preparing for chest tube, making incision. Test.
Get your finger in the pleural space. What are you feeling?
Smooth pleural. Lung. I think I'm good. Chest tube.
Left foot is cold. No pulse. Her knee looks pretty mangled. This could be vascular injury.
Page vascular. She's gonna need the OR. Still no pulse.
No cardiac or electrical activity. Okay. I think that's it.
You think? Or you know?
I know.
So you're confident?
Yes. Asystole, no cardiac activity on ultrasound, prolonged downtime. We managed the correctable causes of traumatic cardiac arrest, 3 units packed cells, bilateral chest decompression, no pericardial effusion, and a stable pelvis. I'm confident that after the massive head injury suffered by this patient, she had no chance.
Then call it.
Time of death, 10:14 a.m. Thank you, everyone.
Yeah, let's see. Can you tell me what happened, Mr. Monroe?
Kind of stupid. My fault, really. I've been trying to lose a few pounds, so I hid the cookies up in the cupboard. But I got a craving, so I climbed up on the stool to get them. And bang. I didn't want to come all the way down here. The boss insisted when she got back from work.
You a nurse?
A nurse's aide at a retirement home. I work the night shift.
You're not supposed to call it the graveyard shift there, you know.
I get home and he's white as a sheet. Can barely stand from the pain, but it's all, no, I'm fine.
She worries.
Only because she cares.
We should all be so lucky. It's gonna be cold. Okay, well, I'm seeing some fluid here, so this could be an indication of internal bleeding. You need a CT.
You stay so dark.
We need to bring him to the resus room, stat. Hello. The endoscopy showed enlarged veins in the esophagus, which ruptured from your fall. Subsequent tests, however, reveal cirrhosis and liver failure. I'm sorry to tell you that with this amount of damage, the chances of the liver recovering on its own are pretty slim.
Is there anything we can do?
We're starting medication now, but Walter will also need something called a varicose ligation, which means a surgeon uses rubber bands to stop the enlarged veins from bleeding. Long-term, though, the liver transplant is your only option.
It's what a lifetime of drinking gets you. It's probably what I deserve.
I'm sorry.
Excuse me, doctor?
Yes?
You mentioned a transplant. Does it jeopardize that, him having been a drinker?
Well, he would have to be sober for a minimum of 6 months.
He's 4 years sober. I'm 6. We met in the program.
I'm sorry to bring you such bad news.
We've overcome a lot. We'll get through this, too.
I think we can speed walk a aerosol ligation into OR.
What's this coag look like?
Labs just came in. Blood alcohol level, 0.09. I couldn't smell it on him.
Might have been vodka. He's cirrhotic? Yeah. Seasoned ones know how to hide it.
No, his fiance says he's been in recovery for years.
Guess he slipped. They always do.
I was so focused on the cirrhosis I didn't question the x-ray. Look, do you see anything?
Fracture to the sternum, none to the extremities, trauma to the abdomen. Is there any circular bruising?
Yeah. Does this look like a fall off a stool to you?
That's a tough angle for a stool.
Could it be steering wheel trauma?
My guess is that your drunk was driving, and by the looks of it, may have been in a serious accident.
Timeline tracks for the hit and run we got this morning. The mother we lost. The daughter, how's she doing?
She'll pull through, no thanks to that asshole.
Well, even if he was in an accident, doesn't make it that accident.
You sure about that? We put in a chest tube to drain the fluids, and we performed a surgery to repair the torn artery in your leg. Both were successful. We'll keep you for observation, but you should make a full recovery. We called your dad. He's on a flight now, so...
Can I see my mom?
I'm so sorry.
Lydia not here?
She's gone to get some air.
Walter, do you drive a blue sedan?
Why?
Because your labs came back, and there was alcohol in your bloodstream. And the bruising on your abdomen, the placement of it, it suggests that you could have hit a steering wheel.
I started slipping. Once or twice. And then last night with a buddy. I don't remember what happened. I woke up a few blocks from the house in a smashed car. Lydia wasn't home from work yet, so I left it in the lot and just hoped that what I hit was parked and empty.
A mother and a daughter came in this morning, hit by a blue sedan.
Are they okay?
No, Walter. They're not.